Give you some information about the presentation today in advance, so we'll be ready to jump right in and hear your presentation, and then we'll do questions after that.
Okay, great. Well, thank you for the opportunity to again be before all of you and speak to you about our proposal. As you know, Second Harvest Food Bank of Middle Tennessee has been around for 41 years. And we have been providing emergency food to individuals and families here in the Davidson County since our very beginning in 1978. Actually, Metro government actually was one of the founders of Second Harvest Food Bank when we started. So we are the emergency safety net for individuals and families in Davidson County who need emergency food. We are located at 16 satellites, which we have strategically placed around the city so that families don't have to travel long distances, along bus routes, etc. We've tried to make it as accessible for those individuals that need us. They can come to us 3 times every 6 months or no more than 6 times a year. We do refer people and we also have on staff a SNAP outreach worker that works with our clients when they come in on certain days to see if they qualify for other federal nutrition programs such as SNAP or WIC or the CSFP program that we are now running that Metro Health turned over to us last year. And so this past year, as you can see by our numbers, we served over 95,000 individuals in Davidson County. Now, on average, these individuals come to us about 2 times a year. We are not a supplemental feeding program, but we are strictly used for emergencies. And the reasons that people come to us are they have high utility bills, they have high medical bills, they have spent their money on getting their car fixed so that they can continue to go to work every single day. These are the working poor of our community. So over 60% of the clients that we see are clients that are working, and many times are working 2 jobs. They're either working at minimum wage or slightly above minimum wage just to make ends meet. And we all know what the cost is in this city. So 1 in 8 Tennesseans and 1 in 5 of those are children that suffer from food insecurity, which means that they don't know where their next meal will come. This program is an expensive program. Not only do we receive donated food for the program, but when we don't get the right kinds of nutritious food for the program, we do have to go out and purchase it. And over the past couple of years, our food costs have risen, as well as our transportation costs. And so that's why we're asking for that increase of $250,000. We also give a stipend to our satellites out there that help us. They do this at no cost really, but we try to help offset their cost of any kind of staffing that they have, etc., to be able to provide these services, but they are utilizing all of our guidelines that we provide to them. Now, we provide a variety of other programs that I think we've supplied you with, of all the different programs that we do in Davidson County to improve people's lives here regarding food assistance for children with backpacks, also for our commodity supplemental feeding program, which is now feeding about 2,800 seniors here in this community, which is a federal program that Metro Health used to run, but now we are running that particular program. And in addition, we also do senior meals at some of the low-income towers. We also run a produce truck to various sites throughout the city so that we can move more fresh produce to those individuals in neighborhoods that we know may have transportation or accessibility or affordability issues to be able to get that produce. Happy to answer any other questions about those. This is a significant program, I guess I might add, in the fact that there is no other program in Davidson County that provides these types of comprehensive services to the most vulnerable of our community. And we have appreciated the support that Metro government has given us over the years, and would love to continue that support to be able to meet those needs of our hungry neighbors in our community.
Okay. Would you just share for the listening audience and those in the room about your picking up the work for the commodity food program? Because people might not be familiar with that piece. That was a huge lift in the past year.
Right. Thank you, Talia. And if you'll speak up a little bit, I'm kind of stopped up, so I'm having a hard time hearing.
Okay.
But last year, we worked with Dr. Paul. We have been working with the Metro Health Department for a number of years. That program had been run by Metro Health for over 20 plus years. And Dr. Paul decided that really we're in the food business and food distribution business, and we could probably run that program more efficiently. And many of the clients we were already seeing anyway, so it made more economic sense to turn that program over to us. We are doing it with volunteers and with some paid staff, and along with our distribution sites in the city. So we've changed the way that we're distributing this food to seniors. We're not asking the city for any additional funding other than the reimbursement that we're currently receiving from the federal dollars to run this program.
So she was able to absorb that program with her volunteers without any additional resources required from Metro, just through
Correct.
the grant money. So it's just really a terrific story.
Right. We were, so one of our goals in that was to reduce costs for Metro, as well as expand services and make them much more convenient for the seniors, so that they didn't have to drive to one location, but that we would have multiple locations that throughout the year that they could go and receive their box of food. For seniors, it's been a little bit of a challenge in making that change, but I think we are working on all of those issues, and we're able to keep all the data that the state asked us and was required by us to do.
What's your operating budget?
Our total operating budget is $46 million. If you include the value of the food, it goes to about $80 million. And that's on our audit. You would see that on our audit. For the emergency food box program, it's a little over $4 million just for this particular program. So this portion of the $250,000 allocation that we're asking for is only about 4% of our total emergency food box expenses that we have.
How many staff do you have?
We have 116 staff currently. Now, we actually cover 41 counties. We just don't cover Davidson County, so those people are strategically placed in various counties. So currently, in the past year, we opened up 2 new distribution centers, one in Camden, Tennessee, in the far west, that employs 6 individuals out there. And then we opened one in Rutherford to service our southern counties and those agencies out there. And that employs about 10 people currently.
What percentage of your work is done in Davidson County?
I would say,
Ballpark is fine.
yeah, ballpark, I would say over 80% of our work is done in Davidson County. Now, we do service all those other counties. The majority of money that we raise from individuals and foundations, et cetera, about 80% of that also comes from Davidson County and the 6 surrounding counties as well. But we do raise money in all 46 counties that we serve. Yes.
And where were some of the satellite locations in Davidson County that you mentioned?
Well, we have a number of those. Probably our longest running partner is St. Luke's, as well as Martha O'Brien. We also work with the Salvation Army, the United Methodist, Hamilton United Methodist out in the farthest part of Antioch. Those are probably our largest ones that we serve. Martha O'Brien has been with us, and along with St. Luke's, has been with us since day one. Now, one of the things that we're really striving for, and I know people are very conscious about, is the nutritional mix that's in that emergency food box. And we are very conscious of that. And so we are trying to provide more produce, if we can, in those boxes, because when people go in, the box is packed according to the number of members in the family. So if there's only one individual, it's going to be different than if there are 5 individuals in that family. And so we do have a variety of populations with different dietary needs. So we also try to meet those dietary needs as well. And so we're providing more fresh fruits and vegetables in those boxes. We're looking at the salt content in those boxes. We're trying to provide foods of what we call foods to encourage. And then many times we'll also put recipes in there of different things that they can do with that food box. Now remember, that food box is only going to last anywhere from 5 to maybe 7 days. Again, it is not a supplemental feeding program. It is strictly used for an emergency to get them by. But then if they need a more permanent feeding program, we're going to refer them on to other organizations or federal programs that they may be able to apply to and are eligible for.
Do you track the recipients maybe by zip code or
Yes, we
something
do.
like that?
We
So
track
we
them
could-
by zip code. I will tell you, we saw a huge increase in the months of December and January. We're not really sure about that, whether part of it was because of the government shutdown, which it very well could have been. I think part of it was because of the food stamp issue early in January, and so we've seen our numbers increase. We're hoping those numbers will decrease. We also are seeing a slowdown. You know, we saw a little bit of a slowdown in our economy during those winter months because a lot of the folks that come to us are seasonal workers. So if they're working on construction and it's raining or snowy or cold weather, then they can't work, and many times then they'll have to go out and get food from us. One of the other things that I think we do really well is the backpack program, and one of the programs that we're working with is the Heroes program in the city schools with the homeless kids. And last week we had Catherine, who runs that program, come and speak to our board about how many kids, and I was floored that there are 3,400 homeless children in metro schools today, and that because of us, we're able to assist those children and their families. Plus, we also do, we're in a number of schools here in Davidson County, here in Davidson County, with our family pantry program as well, so that we can treat families as well as individuals or just children through the backpacks.
Okay.
Thank you.
Thank you.
Thank you so much.
Great, thank you, thank you.
I hope you
Good
feel
to see
better.
you as always.
Yeah.